Good morning.
Good morning.
I'm so glad you guys made it through all of the activity outside to join us this morning. I'm Johanna Derlega, publisher of The Hill. Welcome to this morning's briefing, Preparing for a Treatment, Managing and Delivering an Alzheimer's Breakthrough. I'd like to start by thanking our sponsor, Biogen. November is National Alzheimer's Disease Awareness Month, and this morning we are focusing on efforts currently underway to fight a disease that impacts some 5.4 million Americans. As research to combat the disease progresses, how are stakeholders preparing for the possibility of innovative treatments? And how can policymakers prepare to address issues of earlier diagnosis, access to treatments, and ongoing monitoring of Alzheimer's patients? This morning, we will hear from key stakeholders about what can be done to ready America's healthcare delivery system for the possibility of a significant advancement in the treatment of Alzheimer's. Before we get started, just a few notes of housekeeping. In addition to those of you in the studio, we are live streaming on thehill.com. We ask that you keep your phones on silent, but we'd love for you to join the conversation. And you can follow us on Twitter at The Hill Events, and you can comment using the hashtag tomorrowsALZcare. We're going to be taking questions from the audience during the program, so just keep an eye out for those with handheld mics. And then finally, there is a short survey on your chairs. We would love your feedback, so please fill that out at the end of the program. Let's dive right in. We begin this morning with Elizabeth Urinka, who is a Chief Health Policy Advisor to the Senate Finance Committee minority staff. Joining her on stage is my colleague, the Hill's Policy Editor, Kim Dixon. Come on up and welcome. Kim, over to you.
Thank you, Johanna. Thank you, Liz, for joining us on this busy day in health policy. It never seems to be not a busy day. So this week, the Washington Post wrote about a RAND study sort of highlighting some of the challenges we have with Alzheimer's. 5.4 million Americans, a new case every 60 seconds. And yet, on Capitol Hill, there are competing priorities when it comes to healthcare. So how do you break through what is going on Capitol Hill when it comes to this issue?
So I guess we're going to start with the softball question. Is that what we're doing? First, thank you for having me this morning. Look, I think the interesting thing about Alzheimer's is that we know it hits every family, right? We know that you don't walk into a room without knowing someone or someone who has a family member that has, unfortunately, been faced with this disease. And as a result, you do have a bipartisan interest in figuring out what to do to address all of everything that comes with Alzheimer's, whether it's the actual diagnosis or hope for a cure one day, what we are or are not doing as it relates to treatment or actual just management of folks that have been diagnosed. And there are a lot of folks on the Hill that are interested in how people are cared for, not just the delivery of services, but what you do to compensate or take care of those that are taking care of a loved one or someone that is managing this disease. So I think from an interest perspective, you have folks on the Finance Committee in the Senate, you have folks in the House, I'm sure, on the other committees that are very interested in this, and then you have our appropriators that really want to make sure that more money is going to the NIH and other, research facilities to really tackle the underlying causes of the illness. Having said that, you are correct. This has been an interesting year on a whole host of levels. We have been doing ACA repeal for longer than we should. Let's put it that way. So yes, it is difficult, and I think that for these members that are really interested in moving forward, my boss, Ranking Member Wyden, was very, very happy and lucky to have found great partners in Senator Isaacson and Senator Warner and the chairman in working on a bill that would address folks with chronic conditions. And one of the provisions in that bill was the Independence at Home expansion or extension of a demo that he had worked with Senator Markey on for a long time, actually. And I remember Senator Markey tells the story of him taking care of his father taking care of his mother who had Alzheimer's, and what was required to do that. And this Independence at Home model was meant to take care of people in their homes for as long as possible. That's the type of thing that I think members of Congress in a bipartisan way would like to be working on. And the fact that we continue to talk about the Affordable Care Act and how to dismantle it or how to sabotage it, all those things is a real distraction to the issue I think that we're supposed to be talking about today.
You talk about payment models. So are those payment models moving forward seamlessly from the Obama administration to the Trump
I
administration?
think that's another good question. You know, yes and no. I think there are a lot of people that are, there are a lot of people within this administration, career staff, that are very interested in moving away from fee-for-service into more value-based care. I would never undermine kind of the work that they are doing. Having said that, we do need leadership in this area, right? We need to see people pushing forward. We need to see providers that really want to do this type of work. We need to see them supported, I think. And again, I go back to, you know, any efforts that are underway within this administration are being overshadowed by the big headline and big ticket items that are, you know, the individual mandate or CSRs or, cost sharing reductions and outreach and enrollment. We're missing an opportunity, I think, to really move ahead.
So who you mentioned Senator Isaacson. Who are your allies on the Republican side, and what's the most promising thing? Would it be that caregiving at home in terms of moving forward in the next 6 months?
Oh, moving forward in the next 6 months, that's like an eternity on Capitol Hill. No, I think Senator Isaacson has been an incredible champion. Senator Toomey and Senator Stabenow together in a bipartisan way have identified Alzheimer's as something they would like to work on. But again, I think we need to kind of break this logjam and start working on actual payment reform in a more positive way rather than kind of maybe entitlement reform for the sake of entitlement reform, which may have significant consequences for folks that are battling this disease. As an example, I mean, 11% of, I would say 27% of folks with Alzheimer's are both dually eligible for Medicare and Medicaid, compared to 11% of the rest of the Medicare population. So we really have to be careful about what happens to the Medicaid program, generally speaking. It's the biggest payer of long-term services and supports. And when we see challenges, or when we see maybe that's the nicest way of putting it, to the Medicaid program like we did earlier this year, whether it's turning Medicaid into a block grant for the expansion population or per capita cap for the underlying program. It should be a real problem for folks that are advocating for patients and providers and caregivers of those with Alzheimer's disease.
And then there's the issue of once, hopefully there will be an effective treatment coming soon, and if there is a breakthrough, you know, how do we pay for it?
Absolutely.
How do we administer it?
Right, that's exactly right. And I think the administration of it is also really important. It's one thing to have a cure. It's one thing to have a treatment. You need to have people that can actually administer that treatment, that can care for the both kind of direct treatment of the disease, but also all of the services that are necessary to make sure that these folks, these loved ones, people that we all know and are in our communities are taken care of. 95% of folks with Alzheimer's have also chronic conditions. They are more likely to be in the hospital, I think, by 3.5 times. So the support necessary is critical. And frankly, the Medicare program right now, I don't know that it's completely ready for it. And that's not meant to be daunting or scary. It's meant to be a challenge that I think members of Congress and others should be rising to. I certainly know that staff is interested in that, but I think you did mention the issue of drugs. It is an elephant in the room, there is no question. Senator Wyden partnered with Senator Grassley and did a report on Sovaldi, the Hep C drug by Gilead. It was a case study in what happens with a breakthrough therapy. We don't know what to do with that. We don't have the answers for that yet when you have something that is so revolutionary, and we hope for that with this disease as well, that comes, that comes along and as quickly as possible. But how we pay for it, both from the Medicare kind of standpoint, but also what happens with Medicaid programs, what happens with the private payers. It's a question we don't have answers for yet. We do need to be able to have the discussion in a rational and bipartisan way, because I think that I don't know any member of the Senate or the House that doesn't want to see patients get the best care possible at the right place at the right time. And so any type of barrier to that is really going to be problematic.
So what about specialists? One of the things in the RAND report was that, is there anything the Hill can do to encourage better training or more training of the types of doctors who can diagnose early? Because that's so important, I know.
Sure. I mean, I think yes, and I guess yes and yes, right? So again, I go back to the idea of the right care by the right people at the right time. Understanding what the role of that specialist is, I think is going to be really important. But again, I go back to this idea of payment reform and moving to whether it's advanced payment models or just more value-based care. In some ways, the way I see, when I'm trying to do my job, I don't want to necessarily advocate or recommend to my boss that we need to micromanage what the system has to do at this particular intervention. I think what we need to be doing is saying, okay, what is the best delivery of care that says the incentives are right for the patient? Right, so, and the incentives are right for the provider to take care of that patient. And if we can do that, then Congress doesn't need to say, okay, this particular specialist needs to get this amount of money to do this specific thing. And I think, whether that's supporting medical education, whether that's more research for an actual cure, all of those things are important, but all of them are part of this kind of ecosystem of how to care for this population.
All right, well, we could probably stay here and talk longer, but I know you have to get to a markup,
Apparently.
and we have a full schedule ahead, so I just want to thank you for coming.
Thank you, and thank you for doing this today. Thanks for having me.